DePuy, as most of you know, is a Johnson & Johnson company, a division of Johnson & Johnson, and DePuy Orthopedics specializes in the production of custom hip implants and other orthopedic devices. They've recently, as of the end of August of 2010, recalled one of their major lines of metal-on-metal hip implants. This particular model is known as an ASR XL. ASR is an articular surface replacement system, an effort to design a hip implant that has a metal ball that inserts into a metal socket or an acetabular shell that then goes into the patient's hip socket or acetabulum, and that acetabular shell has a porous coating that grows into the hip socket of the patient, ideally over time, and then the ball allows a free range of motion within that steel cup. The problem is they used a couple of errors in the design process with this particular metal implant. We think the defect is probably at least twofold. In one aspect, these particular metal implants may be problematic across the industry. There's no question that in these patients, high levels of circulating chromium and cobalt are being found in the blood and the urine of these patients who are being tested months or years after they have the implants placed. The reason we think that's occurring at a very high rate, in particular in these ASR patients, is that this implant that's designed with a semi-hemispherical acetabular cup or acetabular shell has such a shallow design that when surgeons implant it into the patient's hip socket, they can't get a good fit often. The angle at which they either antevert or decline the acetabular shell into the hip socket is extremely prone to problems. If they can't get it just right, which seems to be happening in at least 13% of the cases, that acetabular cup actually doesn't tighten in. It becomes loose over time. The patient starts developing slippage. They notice clicking and popping and disability on standing or sitting or getting up from a prone position, extreme pain, extreme laxity in the hip, a real diminished range of motion, and problems with mobility. Over time, this looseness of the shell becomes obvious on x-rays. Patients have to walk with crutches or on canes or walk with canes or walkers, and eventually are going to need the hip implant redone. So at least one more surgery, but more importantly in these cases perhaps is the fact that these people have not been told until recently that DePuy and Johnson & Johnson knew for years that there was a very high failure rate of these implants. So many folks didn't need to go through this hip implant replacement system at all, and probably have undergone ongoing damage to their hip implant socket, to the actual articular joint in the hip, so that there's going to be necrosis in many cases of the hip socket of the synovial cavity. Many of these people are developing high fevers, rashes, severe fatigue and malaise, and not knowing what it's about until finally DePuy has recalled the implant, even after saying for the last couple of years that they were phasing out the model because of poor sales. Well, in fact, it wasn't poor sales. They were trying to spend their time going around scooping up all the cases, getting people to sign medical records releases so they could find the patients through the doctors and settle the cases quickly and quietly. Only now, as of August of 2010, did they recall an implant that they've been saying for at least a year was not a good implant, and that we believe for at least 2 to 3 years they had knowledge that these things were failing at a very, very high rate. So these folks have gone through this procedure, have gone through this period of disability, have developed essentially a rotting away of their hip socket with high levels of these circulating carcinogens, cobalt and chromium, which could have been avoided if DePuy and Johnson & Johnson had simply done the right thing at least 2 years ago and pulled these things from the market when they realized how bad they were. So what we're recommending is that you go back to your doctor, you follow up with him. If you have any kind of a DePuy product, give us a call. We'll be happy to walk you through this. But don't sign anything. Don't sign a release. Don't give the manufacturer a release of your medical records, because all they're trying to do is defend their cases. They're trying to build the case against you, get you to settle quickly and quietly. They're requiring people to give them a release for medical records and then to turn over their hip implant upon explantation of the implant to them without any recourse to that product. And of course, that product is at the heart of any products liability lawsuit. If you want an attorney to represent you to get you all of your damages, not just replacement of the hip implant, but damages for what you've gone through since you first had the hip implant put in and what you may have to go through in the future for multiple surgeries and possibly investigation of the nature of the cobalt and chromium damage in the body. Then you need to call a law firm who's experienced in handling orthopedic device litigation. Give us a call. We'll be happy to tell you what your rights are and see if we can help you pursue a case so that you're fully compensated.